Hi there, my name is Katarina. I'm a pediatrician specialized in endocrinology and diabetes. And for 1 year, I worked with Berlin's Refugee Health Unit. I'm a doctor and a patient. When I was a kid, my immune system shut one of my vital organs down, and I was diagnosed with type 1 diabetes. Type 1 diabetes means multiple blood sugar tests and insulin injections every day and regular visits at a specialist doctor and the pharmacy. In daily life, it is quite difficult to keep your blood sugar levels in range. Whatever you do impacts it. What you eat, when you're sick, physical activity, whether you're nervous or excited, everything can potentially make your blood sugar go up or down. Too little insulin will result in a high blood sugar, and too much insulin will result in a low blood sugar. Both can be life-threatening acute events. In this room, 100 people, at least 20 more of us have a chronic condition. I'm sure there are people sitting here amongst us who are affected or have a friend or a family member. If you want to show yourself, feel free to do so. I'm here today to talk about a neglected group of refugees, those with chronic conditions. There are missing people. While some arrive, most don't. Amongst the people migrating across borders, there is the same occurrence of chronic disease as in any population. Refugees face many challenges every day, even if they do not need medical service. But for those who do, finding access to medical care becomes a major challenge. Without health insurance, many of them have to rely on volunteer doctors like my colleagues and myself. In conflict areas like war-torn Syria, there are only a small number of operational hospitals left. Many of them are working underground. Usually, civilians and places like hospitals are protected by international humanitarian law, and violation of these laws is considered as a war crime. But in Syria, they have become main targets of airstrikes, and the hospitals we see on the news today likely won't be there tomorrow. In our Refugee Health Unit, we have helped more than 60,000 people since the war in Syria started. That is more than 200 people per day. Half of them are children. Amongst these children, we have seen many infections, malnutrition, psychological trauma, but only a few with chronic conditions, those that we see in the hospitals of our country every day. Diabetes or cancer doesn't care how old you are or if your country is at war. It just happens. Also, when it will happen to a child is totally unpredictable. Working with the Refugee Health Unit, we have received 3 children with type 1 diabetes. Amongst the 60,000 people we treated, there should have been 250 children with diabetes. We're wondering, where are those 247 children that should have arrived? Today, I'll tell you about one of the 3 that did. Mohammed, who is with us in Berlin now, where his chronic condition can be cared for. Mohammed is a 10-year-old boy who arrived in Europe just last month. Here, he's sitting in his hospital bed with his mother and father. He is my patient and I'm his doctor, and our life stories couldn't be more different, but there's one thing that we have in common. We both live with type 1 diabetes every day. In both of our lives, there was a day when our parents got extremely worried. We were always thirsty despite drinking enough. We rapidly lost weight despite eating enough. We were irritable and short of breath, and something was definitely wrong, so both of our parents decided to take us to the doctor. And the doctor told our parents, "Your child has diabetes. The good news is your child is going to live, but there's no cure, and your child will have to inject insulin every day. Without insulin, a small child with type 1 diabetes can only survive for up to 2 days. In my case, this was the 14th of June in 2001, and for Mohammed, it was the 14th of November in 2015, which was also the day when their hometown Aleppo was hit by a severe airstrike, and ironically, was also World Diabetes Day. After their home was bombed, Mohammed's family had no choice but to leave and find a new insulin supply. At first, they were able to find it on the black market. They could only find it there, because the only insulin-producing facility in Syria was bombed in 2015, so insulin had to be brought in from neighboring countries, such as Turkey or the Lebanon, and it was, of course, heavily overpriced. But diabetes management requires more than just access to insulin. Even in a hospital setting with diabetes specialists on hand, it usually takes a few weeks to get the dosage right. Mohammed's family knew nearly nothing about how to use insulin, but his father suffers from type 2 diabetes, which may have saved Mohammed's life. Although type 2 is quite different from type 1 diabetes and does not require insulin in every case, Mohammed's father at least knew how to perform a blood sugar test on his son's finger and at least what the numbers meant. After some time, they were unable to find insulin anywhere in Syria, so they tried to flee to Europe and took the risk to travel overseas, which was the next big challenge for Mohammed's family. The decision to leave is already a challenge, but the journey itself is risky and without support along the way. When refugees fleeing towards Europe need medical aid, there's no guarantee that a doctor or a hospital will take them in. Without being integrated into the local hospital systems, they might be unable to afford or request medical attention. Mohammed's family fled to Turkey over the border and then paid smugglers for passage to Greece and into Europe. Most smugglers who take people over the Mediterranean Sea force them to leave everything behind so they don't sink. Mohammed's father secretly kept one thing, the insulin, and saved his son's life. Mohammed's parents, like all parents in and outside this room, were willing to do absolutely everything to save their child's life. What would you do if there was no way to survive a few more days in this country? Unfortunately, not every family wins this fight, and in some cases, vital medication gets thrown overboard. So this story is also for them. When Mohammed's family left Syria, they had no idea what would be waiting for them. They were hoping to find a safe place where Mohammed could survive, but they didn't know the camps in Greece would be just as overcrowded as those in Syria and the neighboring countries, with terrible hygienic conditions, and that a long episode of hardship and monotony was waiting for them. Even after arriving in Europe, the time it took for integration and acceptance became a burden. The family split up in Greece. Mohammed's mother went ahead to Germany with their 2 youngest siblings, immediately applied for asylum, and the application process for the family to be reunited in safety. But it would take another 1.5 years, from 2015 to this year, for Mohammed to be brought into his mother. And that was also the first chance to see a pediatric diabetes specialist. He had arrived in Europe and survived without any real support from any European medical system. The patients we treated have all suffered hardship. First, the situation in their home country that forced them to leave, then the long journey, and finally, even logistical and administrative challenges upon arrival. The health checkup on arrival in Europe is sometimes the first opportunity to see a doctor in weeks, months, and sometimes even years. In Greece, all Mohammed's family had was only one type of insulin, in the form of a drug we mostly don't use in Europe anymore. and no specialists to support them. Under these conditions, Mohammed only survived by luck and thanks to the support of his family. Can we really claim to be taking proper care of those in need even after they have arrived? 2,000, that's what Type 1 International, a diabetes activist group, estimates as the number of Syrians in dire need of insulin. Before the war, diabetes, like most chronic health conditions, was a manageable disease in Syria, yet suddenly it has become a death sentence. Not only in Syria, but around the globe today, people with type 1 diabetes and humanitarian crisis are dying. For those who stay, the economic situation is often so bad that they cannot afford to eat or drink, so how would anyone be able to buy medication? For those who leave, finding access to medication and doctors is even more complicated when they get stuck at refugee camps or at closed borders. Today, there are over 50 million people violently uprooted from their homes. That is about 250,000 people with type 1 diabetes, without structure and safety, without access to insulin and diabetes education. That is as many as the population of this city, living in a dire, life-threatening reality. This is a terrifying number, but numbers and statistics don't always tell us enough about who these people actually are. Mohammed is a story about the individual person behind those numbers. It is a story about that everybody has a name, that everybody is somebody, that everybody has a story and a medical history. During war, bombs and guns are not the only things that kill people. For many, it is the lack of infrastructure that is their death sentence. A skilled person or a helping hand in their daily challenges can save lives. And access to the systems of care that we are so proud of can be the difference between survival and death. For the 247 missing children, we can support organizations like Type 1 International or Doctors Without Borders that are going beyond our national borders to help. For those who arrive and live in the refugee camps next door, each one of you can contribute by making our own neighborhoods a safe place for them so that they can live a life in safety, in peace, and in dignity. Thank you.